Good morning, everyone.
Good morning.
Good morning.
This is Jill Ryan. I'm Executive Director of Freshwater Future, and I just want to welcome you to our third in a series of 6 webinars called All About Water, focused on water affordability and all the reasons and things we need to do about that. So we're really excited to have amazing speakers today. We're excited to have all the participants who are on, and we have a great lineup for you. So just a huge thank you to our speakers, to our staff who have done an amazing job of preparing all of this, and to all of you for coming to participate with us. Thank you.
Awesome, thanks, Jill. I'm going to get the presentation started. The first thing that we have on our agenda is just some housekeeping, logistics. Same as last week. Our attendees, you will be muted and there won't be any video, but during, if you have any questions, which we'll have at the end, there is a Q&A section and a chat box sessions for general comments or concerns about tech. So please feel free to utilize those tools down at the bottom of your toolbar. And then lastly, any resources, session information, presenter profiles are going to be found on our website, www.freshwaterfuture.org. So our first piece here is going to be from a Benton Harbor native young person who is a member of the Benton Harbor Water Council, Maya Clay. And this is her song, They Can't Put Us Down. The inspiration behind this song was the hardships that the youth of Benton Harbor were facing, especially during the time of COVID.
They can put us down, they can kill us. We're gonna show them how we get all these haters. Making big beats, we stacking papers. We on a mission, making offers and haters. They can put us down, they can kill us. We're gonna show them how we get all these haters. Making big beats, we stacking papers. We on a mission, making offers and haters. I was down, about to drown. In the tunnel, boy, I had to be found. Hey, on my own. I was wrong. My homies grown, and we growing and it's shown. And we flexing, and we strong. We bout that bag and we finna be gone. We out this bag, finna be gone. Ain't nobody gonna take that from me. They can put us down, they can kill us. We're gonna show them how we get all these haters. Making big beats, we stacking papers. We on a mission, making offers and haters. They can put us down, they can kill us. We're gonna show them how we get all these haters. Making big beats, we stacking papers. We on a mission, making offers and haters. Reminiscing about your past, you gon' lose. When you make these bills, you pick and choose. On the stool, having fun breaking the rules. Keep your head in them books, you ain't gon' lose. Forget people, rebel children, crazy childhood. People always creeping. Hey, racist cops shooting bullets while you sleeping. You asleep. All this corona shit, how you think you dreaming? Bust it down, rebuke these demons. To all my homies, we can make it, keep believing. That's why I still thank God for all these reasons. Keep your head on your shoulders, know what you think. They can put us down, they can kill us. We're gonna show them how we get all these haters. Making big beats, we stacking paper. We on a mission, making offers and invaders. They can put us down, making killers. Gonna show them how we get all these haters. Making big beats, we stacking papers. We on a mission, making offers and invaders. They can't put us down, making killers. We come to show them how we kill all these haters. We're making big beats, we stacking papers. We on a mission, making offers and invaders. They can put us down, making killers. We come to show them how we kill all these haters. I'm making big beats, we stacking papers. We on a mission, making offers and invaders. We changing all lives.
All right.
Awesome. So that was one of the youth from Benton Harbor. She's also a member, and she sits on the Benton Harbor Water Council, which you'll hear more of later. But she talked about how the hardships and having the elevated lead levels, not only in their homes, but in their schools. There were many students who were concerned about, the health implications around drinking contaminated water. And then on top of that, having water shutoffs and facing COVID, then on top of, what we're seeing with systemic racism, she felt best way that she can communicate with the youth in her community is to put out this song. So we appreciate her allowing us to share that with you all. Without further ado, I'm going to hand it over to the great friend and brother, Brandon Tyus, who is going to be our moderator for the rest of the session. Thank you, Brandon.
Thank you, Alexis, and thank you all for attending this webinar. I'm really excited for the information that is about to be shared today, and I'm not going to hold you up with my heartfelt appreciations. I would like to bring in a very, very special speaker. I spent quite a bit of time with him. He has been an outstanding leader, and he's the kind of person that's never been afraid to speak up when he knew something was right. So without further ado, I would like to introduce Reverend Edward Pinkney.
Brandon Titus, thank you so much for those kind words. I really want to talk about Jill Ryan and Elisa Smith. Without them, we would never had a water council in the city of Benton Harbor. They immediately went to work and got us started on this. But I want to introduce the members of the Benton Harbor Community Water Council. Myself, Reverend Pinkney, I'm the chairperson. Brandon Titus, he's our vice president. Dr. Donald Times, he's our medical expert. Lugene Anderson and Larry Sims, Frank Blue, Janine Blue, Tawana Wilburn, Tanita Holmes, Maya Clay, Sean Clay, Emma Kennard, and my very own wife, Dorothy Pinkney. And our mission, the Benton Harbor Community Water Council, is dedicated to community coalition building and to the provision of resources that inform, train, and mobilize the citizens of Benton Harbor beyond their quality of life. Our vision as a community-based grassroots organization, the Benton Harbor Community Water Council aims to be informed, educate, empower Benton Harbor residents about water, education, and other things. Public health benefits, reduction in the risk of exposure to the PPB that can cause damage to the brain, red blood cells, and kidney, especially for young people and pregnant women. The reduction in risk at the expense to cardiac case to the stomach, instant and distress, liver, kidney damages, and complications of the Wilson disease. Benton Harbor is one of the poorest cities probably in the state of Michigan. 94% of the people live here are African Americans. We have 70% of the people living below the poverty level. We have 65% of the people unemployed. And we have one of the worst problems in the history of mankind with the water itself. But what I want to talk about today, I want to talk about how we got to be partnership with the Barron County Health Department, which was very interesting to start with. It started off by the city of Benton Harbor saying that the water was good. And we all know that the water have never really ever been good here, and probably since the 60s or the 70s. But unfortunately, they was telling people that the water was good. My good friend Emma Kanai, she's a member of the Benton Harbor Community Water Council. She went to the city council meeting. She took 3 pints of water that was yellow, and they refused to acknowledge it for the simple reason because they just got through telling everybody that the water was good and it was drinkable. So when they refused to even look at it, that's when we went to work. We went to the school system to test their water, and they discovered that they had 640 ppbs in their water. It was undrinkable. We went to another school. It had 400 ppbs, which was, 15 is the minimum, which even 1 is unacceptable. And at that time, we decided that we had to do something better. We had to go to work and deal with things. We went out, thanks to Freshwater Future, and purchased water filters for the people that we water tested. And we not only did we give them the water filter, we also put it on for them, which was a lot of times when you give a person invested in this community a water filter, you got a 75% chance of them not even putting it on, just having a water filter. So instead of just giving it to them, we went to their homes and started putting it on. And then we invited the Barron County Health Department to an event that we was having, because it was our understanding that the people in the community was not getting the water filters like they should have. So we immediately went to work and start not only training them how to put the water filter on, we also started partnership with the Barron County Health Department during that phase. Brian Titus, we went to River Terrace apartment, and there's 180 apartments in that building. And we made sure that each and every person in that building had a water filter, not only in their home, but we also put it on. And that's how it worked. Brian Titus, he was really spearheading this whole thing. We was working hard together, making it happen, and then show people what we can do when we learn to work together. And I really appreciate the thought and the energy that the Benton Harbor Community Water Council have, because we want to get it done. We want to show them that we're willing to work, and we're not asking for any recognition, nothing like that. We're not doing it for that reason. We want to make sure that every single person in the city of Benton Harbor has a water filter. We know it's just a Band-Aid. We know that, but it's a start. We want to make sure that if we can't do anything else, we want to make sure that every single person have a water filter. We also start boxing off the community on how we was going to deal with each person. We was going door to door, knocking on the door and asking them, did they have a water filter? Which is a lot of work, but it meant so much because it educated the community on how the value of having a water filter. And I think that was one of the best things that we could have done, going door to door, knocking on people's doors. We selected certain communities that we went in, and we made sure that at least in a certain area, every single person had a water filter. If not, we would try to take one out to them, deliver one to them. We did all kinds of things to make sure that they have clean water. And during the process, we would educate them. We would tell them like how to use the water filter and which water filter was good. And it is important to replace the filter as recommended by the manufacturer. And what we would do, we would give them, if you probably can't see this, but this tells you when the water, the green filter is good, keep drinking. The yellow filter, replace soon. The red, you need to replace immediately. So that was one of the things that we passed out. Also, it said if you do not have a filter and have not used your water for 6 hours or more, flush your pipes to reduce the amount of lead in the water, in the drinking water. You can flush your pipes by turning the faucet all the way up, taking a shower, running a load of laundry, or doing a load of dishes for at least 5 minutes. After flushing, run the water from any faucet until cold become drinking or cooking with the water. Do not heat or boil your water to remove lead. Hot water will increase the amount of lead in the water. Clean your faucet strings at least every 6 months. For information on how to clean that was our job. We had to show them how to do it. And I think
Reverend
that was
Pinckney, you have
important.
2 minutes remaining.
Very good. Thank you there. And what we wanted to do, we wanted to show them how to do them. We also informed them that they are never to ever run hot water through the water filter, which will even shorten the life of the water filter. We had to show them what needs to be done, how to do it. And when you're dealing with people that's poverty stricken, the last thing on their mind is basically a water filter. A lot of people are saying that I've been drinking this water for years and there's nothing wrong with me, but that was not them talking. That was the lead that they've been drinking all these years talking in that place. So that's one of the things that I thought that was important. That Brandon and myself, we always talk about that. We always joke about that, which tells people that it's important that you understand how it works. And that's how we became kind of like partners with the Barron County Health Department. And we continue to do things. We would get out maybe 200 every time we have an event. We get out 200 water filters a day or whatever it needs. And that's the way things need to be done in order to make things successful, so that every single person can have a water filter and know how to operate it. If they couldn't get it on, we had a team that would go out and put the water filter on and show them how it worked, and show them also how to cut it off if you're gonna run the hot water through there. And on that note, also one last thing before I leave it right there. See, we believe in affordable, clean water here in the city of Benton Harbor. And with the help of Freshwater Future, we will be successful. And I just want to thank you for taking the time out to listen to me. And we will take it even deeper on our next time. Thank you so much.
Absolutely. Thank you, Reverend Pinckney. And as he has alluded to, I've had the privilege of working with Reverend Pinckney. And can you see how you cannot not be excited when you're around this man? He is absolutely full of passion, ready for the work. And I just really want to commemorate you in your line of work. And now we're going to move on to the next speaker. She is also very well intertwined within the community. She has been a tremendous leader in the movement, working and serving the Latino community. And you can count when she puts her mind and her hands on a project, you can absolutely count that she is putting all of herself into that action. So without further ado, I would like to introduce Miss Wani Olivares.
Thank you, Brandon. Thank you. Good morning, everyone. As Brandon introduced me, I am Juan Olivares, President and CEO of La Placita in Flint. Everybody knows what happened or what's still happening with the Flint water crisis here. Unfortunately, the Latino community or Hispanic community here in Flint did not know that we were going through a water crisis. They found out about the 2-year mark when we started noticing that things were not being translated. Even till this day, things are not being translated. Anything that goes out to the residents is not translated. The websites are not being translated. Limited information still is given out to anyone, specifically those who are monolingual. One of the things that we have been struggling with is providing water to our families here in Flint. As we know that the pods or places of distribution have been closed in the last maybe couple of years or so. The help centers ended up closing because of COVID. As we know, we are all going through this. Unfortunately, because of this, we haven't recuperated from the Flint water crisis, and I don't think we're gonna do so. It's gonna take time and trust. And one of the things that we have in the Hispanic community is the mistrust because of the things that they're going through, or or where they may be focusing on, such as some of them are being, mostly all our families are undocumented. It's very rare to find a family that may be documented, at least the parents. The kids might maybe be citizens, but because of that, the parents still don't qualify for a lot of the services that are being given out here in Flint. And due to the COVID, a lot of the parents have lost their jobs, or just kept working, gotten sick. We're still struggling trying to water. We cannot buy, at least here, buy pallets because there's a high need, not just for one community, but the entire community. Food is another thing that we're struggling with, trying to keep it going. Among other things, medical, even COVID testing has been very difficult, even to get the families or the parents to go. They won't go because of the immigration things that have been happening in the last couple of years with the person in office now. So it's a difficult time for the Hispanic community, not just in Flint, but all over the country. With the COVID testing, it's unfortunate because this is something that reminds me of when the water crisis happened, and or my community, the Hispanic community, found out about it, and they were not being tested for lead because they were being asked for their documentation. Just to even get their kids tested, it's insane. So right now what we're working on is working on a fundraiser to try to provide minimal help, which is not a lot, unfortunately, because of everything that's happening, by providing food boxes to families and basic hygiene personal needs that we've been able to collect slowly. So we do have a donate button on our website, which is www.gchlc.org. If anybody would like to donate or pass it on to other individuals, that would be great. I know that it's a lot of work, but it's something that I enjoy because I know what it's like to be undocumented. And thankfully for me, I've had the great opportunity to become a legal permanent resident. So I know what they go through. I know what it's like to live undocumented. I know what their fear is. I know what it's like to drive without a license, because I did that because there was a need. Unfortunately, I was lucky enough that I'm bilingual and I knew how to defend myself in both languages. They don't have that chance. So I think in a way I've become their voice, but I can't keep guessing what they need, because I'm not guessing. I know what the needs are and they tell me themselves. So if you guys could donate, that would be great. And thank you so much. Thanks for all the work that everybody's doing, because it's not an easy thing, but it's our community and we're responsible to provide those services for those who don't have a voice. Thank you.
Wow. Thank you, Wani. Just so humble in her work. And I believe the key in all of community work is not taking a theoretical approach or guessing what the community needs based on our own, but actually having boots on the ground, talking with the community members that live that life, and being able to know what is actually going on. So thank you so much. And there's a question here. Is there an increase in certain diseases in direct correlation to a lack of water in the United States? It's a very powerful question. I would like everybody just to take that in, marinate on that. Okay. And next, we're going to move into the next speaker. She has been very active in her career of nursing and has been at the table to advocate for transparency and collaboration for the sake of the people that need the help most, that need the support most. And she has just been extremely incredible. She's incredibly bright. And it is a pleasure to be able to introduce Dr. Peggy Berry.
Hey, thank you for the invitation. I'm one of those people that believe that the water is a right, as well as a clean water is a right of access. Everybody should have it. As I go along, if there's questions, I will try to answer them. This next. This is something that I put onto my screen or onto every email that I sent. And that is only when the last tree has died and the last river been poisoned and the last fish been caught will we realize we cannot eat money. And you know, the thing is, I don't think a lot of people realize just how precious, clean, and potable water is to Ohio citizens as well as to the whole United States. And one of those questions that question at the beginning, we can say that the top causes for some of those issues for diseases is, of course, lead poisoning, but also diarrhea from Shigella or Salmonella when you have unclean water, and of course, arsenic and gasoline and mercury and lead. It's just a shame. Okay, for me, I'm going to discuss some water contamination. Actually, mine is going to be very broad since I know I have following me some scientific information. I'm also going to discuss, you know, expanded advocacy as water as a right. Lately, I have found myself writing Governor DeWine and talking about not turning off the water. There's many threats to it. Next. Next. Got ahead of myself. What can I say? There's a lot of threats to our water. There's climate change. There's chemical spills and stormwater runoff, fracking or hydraulic fracturing, coal ash, which has arsenic and radiation in it. You also have agriculture pollution and chemicals, including lead and PFAS. There's also work to repeal and replace the Clean Water Rule with the Trump administration and EPA. I do not know. Currently, I think that's in abeyance at this point. Next. But Ohio water has issues. We have water everywhere. We have it with the Great Lakes. We have it with the Ohio River and even within our streams and our aquifers. So from the Ohio River with the industrial involvement to the Great Lakes with the agricultural runoff and the lead piping and all points in between. Even here, I'm in Dayton, Ohio, and I have concerns about PFAS in my aquifer and those plumes that occur, and which will lead to increased filtering as much as they can do. But I have PFAS, and PFAS is a real concern even with the Great Lakes. So I'm going to go into those issues. Okay, thank you. I guess I could have said next too. Yeah, I want to show you this screen and it's taken from the CDC site on cancer prevalence, and it has not been currently, it's about the same because I can't get anything better than 2017 off CDC websites. As you can see, the higher the blue, the higher the incidence of cancer. So the Ohio River Valley goes up from Vermont into New York, Pennsylvania, West Virginia, Ohio, of course, Kentucky. And all of these dark blue have a higher incidence of cancer. And what they have in common a lot is they take their drinking water. 8 million people take their drinking water from the Ohio River, and it is filled with chemicals. One of the things I got involved with was Orsenco, and you ask Orsenco what, which is the Ohio River Valley Water Sanitation Commission. And I'm learning a lot as we go along with this because of the issues with keeping our water safe. They are supposed to keep certain chemicals at a certain level for the drinking water. And given everything I've heard, sometimes that water just is not safe. Okay, next. We also have mercury in the water. We have it in our fish. Actually, I tend to think that there is no safe level of mercury, and it's a neurotoxin. How someone's health is affected through that exposure, it depends upon a lot of factors, whether it's elemental or metallic mercury or methyl mercury, which is manufactured. But the amount of exposure will lead to liver issues. And I'm off of my slide here. Not only that, how the person is exposed, whether it's coming in from breathing, eating, skin contact, and the health of the person exposed. I don't know how many of you are my age, but we used to have mercury in our thermometers. And when it would break, as a little kid, I used to go ahead and play with the balls of mercury that were on the floor. None of us knew at that time just as how powerful of a neurotoxin mercury was. Maybe I would have had 20 more IQ points. Who knows? Next. Okay, within the Great Lakes, and I'm sure some of you will be talking about this. There are water rights that you all will be dealing with continually with Nestle's. Toledo had issues with toxic algae plumes. There are wind setbacks as well as wind farms that currently need to go into place to keep toxic chemicals away from the lake. And I even believe they're talking about drilling in Lake Erie. Anybody want to tell me, yeah? Have you heard about that? Not yet, okay. So next. Now this is something that really concerns me, and that is something that Alexa and Alicia know a whole lot about, and that is the lead pipes and the water shutoffs that occurred before and during the time of COVID, when you cannot wash your hands. And believe me, you know, you're putting on a mask, you put on gloves, and you're 6 feet away from people, but when you take those gloves off, you still have to wash your hands for 20 seconds. And how do you know if you're going to have water coming through that faucet if the water gets turned off? Also, with the lead pipe issues. I know in Toledo, they're replacing the lead pipes, but not from the street to the houses. And how can you afford that in communities of color and low income? So this is going to be a continuing issue, and given how COVID is now spiking in several states, and even in Dayton, Ohio, we have a spike that is occurring. We're going to continue to have issues with COVID, and we'll need to wash hands. Next. This is my favorite slide, and within the lake you have to deal with the harmful algae blooms, but we also talk about toxic algae blooms, and I know a lot of people have been talking about that with Freshwater Future too, to try and do something in terms of mitigation. Unfortunately with this, we have climate change. Climate change means that we have heavier downpours, and then you're going to have your agricultural runoffs. What worked 5 years ago to try and keep it at bay does not work now until they start really ramping up their mitigation strategies for that. Okay, the in-between. One of the things that I am very interested in, Thank you for changing this slide. I forgot to say next. House Bill 545 is to establish conditions and requirements for the sale of brine from oil and gas operations. This is stuck in committee. We talked about this prior to the presentation, so I won't get totally into this, but do look to see if you can write your senator and House representatives in Ohio, for those Ohio listeners, and ask them to not pass brine as a commodity. And it's referred to the Committee for House Energy and Natural Resources. Okay, next, please. All right, this map is not totally current, but it is a map regarding all of the toxic fluorinated chemical spills within the United States. Although we're looking at one area right now that has problems with lead in piping, we also have PFAS pollution in the tap water for 16 million people in 33 states. And within the Dayton, Ohio aquifer, we have plumes of contamination from PFAS and other chemicals. In addition to that, we have some of our water, our lakes. Ohio's really good about damming up and having lakes in the area. Well, they have toxic algae blooms in them, and also chemicals that have a bacteria that have gone into the lakes. And as that lake water heats up, we're going to see more infections from that lake water. I even met a lady who had a protozoan brain infection from lake water. So it's not a good thing. Next, please. Let's see. All right, my favorite is hydraulic fracturing, or what we call fracking. This is government sanctioned. As much as I hate to say that it is government sanctioned, they are trying to put in a fracking plant in Belmont County. So far, so good. It is not there. And fracking is a known carcinogen, and these chemicals, the fracking pads are like 200 feet away from schools in Pennsylvania. Nursing homes, we've had a couple of fires at these, and I'm so glad that you're checking my time, because I'm always afraid I'm going to go over talking about this.
You have 2 minutes remaining.
I got 2 minutes, okay. So we have fish that are dying from fracking, and we also have wildlife dying because of the plastic or nurdles. And then you have Louisiana Cancer Alley. We are all in this mess because of that. Next slide. You need to advocate, and this is so wonderful that you all have gotten together and you are working on advocacy for water rights. Water is a right. So we're supporting for and backing any type of water rights. Since we've got 2 minutes, next. In addition, you need to collaborate. This is from the Merriam-Webster Dictionary. You need to collaborate with all of the nonprofits dealing with water, dealing with climate change, dealing with food safety and security, because as the climate changes more so, it gets hotter, we're going to have increasing problems even with food security, as if nobody has that now. Okay, we have food insecurity. Next. Okay, my last comments here. I'm a grandma. I may not look it, but I'm gorgeous, right? I have a 19-year-old grandson, and I have a 3-year-old granddaughter, big age range. I want fresh air and clean water for my children's children's children. And I know you do too. I want fresh air. I want tillable soil that's not tainted with fracking solution. I want them to know what we are doing to try and stop the problem or make it or lessen it. So I'll leave that at that. I think there's one more slide with some references, and that's about it. I want to stay on time because I'm really looking forward to the next speaker. Thank you very much.
Thank you, Dr. Berry. That was very eye-opening, and it's a great reminder to us all just how important water is and how easy it is to be careless with our water. And it is a basic component to life, not only for humans, but our food, our nourishment, and being able to take care of that jewel as what it is, a jewel, a source of value. We then not only take care of it for ourselves in our day-to-day life, but for generations to come, because we're living more than the life that we live today, but we are living the life vicariously through the young people that run this world in the future.
And it's not just local, it is systemic. It is systemic. Thank you very much.
Thank you, Dr. Berry. Thank you. And we will move on to the next speaker, which Dr. Berry had alluded to. And I'm also pretty excited about this next topic because this is a dynamic duo. You know, these are active leaders with We the People of Detroit Community Research Collective. And they have worked tirelessly, putting in countless hours of research to uncover needed information to best support community members. And undoubtedly, they have been key assets to We the People of Detroit, to not only Southeast Michigan, but conversely to the world. And that just speaks volumes. So without further ado, this is actually a joint presentation. So our first speaker will be Emily Kutel, and the second speaker will be Nadia Gaber. And Emily Kutel, could you take the floor and really enlighten us, please?
Yeah, and thank you to Freshwater Future for bringing it all together. This has been really amazing for me to watch the presentations this past week, and thank you for all the amazing work that you do. Nadia and I are here representing We the People of Detroit Community Research Collective. We the People of Detroit is dedicated to community coalition building and to providing resources that inform, train, and mobilize the citizens of Detroit. We're going to talk, could you go to the next slide? We're going to talk about the ways that our water affordability crisis is a public health crisis on a tremendous scale. This crisis has major consequences for the safety and stability of our communities. Next slide. In the midst of the COVID-19 pandemic, states across the country have stopped shutting off water, thus acknowledging that access to running water is a fundamental public health necessity. We're in a critical moment to move policy at the local, state, and national levels towards water affordability. Next slide. In the past 10 years, about 170,000 families have had their water shut off in Detroit. Based on our analysis of the water department's data, between 2010 and 2017, we estimate somewhere between 10% and 40% of the city's population, so between 63,000 and 270,000 people, have had the city shut off their water. This practice puts the health of not only of the communities that are hardest hit, but of the entire city at risk. I'm going to give a little context about our water system. Next slide. And then we'll talk about our public health research. Detroit has a vast regional water system. It's one of the largest water and wastewater systems in the world. It contains countless lead soldered pipes and lead service lines. Next slide. The city of Detroit built, maintained, and operated the regional system for 100 years as the water system expanded to facilitate and subsidize the growth of Detroit's suburbs. For our system's entire existence, it has been the center of a power struggle between the suburbs and the city, fueled by segregation and racism. Next slide. Emergency managers catalyzed both the Detroit and Flint water crises. Mass water shutoffs began under an emergency manager in Detroit, and Flint was removed from Detroit's water system and poisoned under an emergency manager in Flint. Next slide. Flint was Detroit's largest wholesale customer. Its removal weakened Detroit's finances and helped justify to the Great Lakes Water Authority, which has majority civil leadership. Emergency managers have the power to override all local elected officials. This practice has been used to usurp locally elected governments in majority Black cities across Michigan. Next slide. Next one. In 2016, we worked with researchers from Henry Ford Health Systems to do a pilot study on the relationship between water shutoffs and water-related illnesses in Detroit. So we were looking at skin and soft tissue diseases and gastrointestinal illness. Next slide. Our research showed that people who were diagnosed with water-related illnesses were 1.48 times more likely to live on blocks with water shutoffs, which is a really high statistical correlation. We found the inverse is also true. So people who live on blocks with water shutoffs are also 1.55 times more likely to get a water-related illness. So we're seeing a really high overlap between people who are getting sick from water-related illnesses and people who are having their water shut off. Next slide. Most recently, we have been studying the relationship between COVID-19 and water shutoffs in the city. So this is a preview of research which we haven't yet released publicly. This is the first time we're showing the public this work. First, we looked at who lives in parts of the city that are most impacted by water shutoffs. So if you remember the map from the beginning, that was looking at the top 10 zip codes by rate and by number of shutoffs in the city cumulatively over the past, from 2010 to 2017. Now we're looking at those areas that are hardest hit, and we can see that those areas are the same areas that also have some of the highest numbers of households with children in the city. So these are families that are getting the most impacted, as well as the highest concentration of people over 65, which you can see especially on the west side of the city. And we know, of course, that people over 65 are much more vulnerable to COVID-19. The city has not yet released their shutoff data to us for the time when COVID hit Detroit, but we know from reporting that up to 10,000 homes were shut off at the time that COVID hit the city. And so we can assume that those shutoffs were concentrated in the same places in the city where the most vulnerable populations live. So these are two maps that show how how the COVID outbreak happened in the city. On the left side of the screen, you can see the rate of COVID cases per zip code. And there you can see there's sort of two centers of the outbreaks. They're both surrounding the places where there are the most nursing homes in the city. Detroit had huge outbreaks inside of nursing homes. For us, because we were looking at water shutoffs and how that impacted COVID, we were really interested in what was happening outside of nursing homes. So how is COVID spreading out in the community and neighborhoods where people don't have access to water? And so what we did on the map on the right side was to look at what percentage of COVID cases in each zip code happened within nursing homes or outside of nursing homes out in the neighborhood. And what you can see there is one of the outbreaks, the outbreak that happened right along the Detroit River on the kind of near east side of the city. A large number of those illnesses took place in nursing homes. If you look at the west side of the city, where if you remember from the map before, there's the highest number of people over 65 living in that part of the city, you can see that the vast majority of cases were happening not in nursing homes, but out in the neighborhood. And so that's a really, really important pattern that we're seeing, that that we need to highlight and pay attention to. If you could go to the next slide. So this is my last slide, which now is just overlaying those hardest hit zip codes with water shutoffs and looking at how COVID cases played out in the city. So we can see over here, right, the darkest green zip code, there's 1,042 cases. Most of those cases are happening outside of nursing homes in the neighborhood. So what conclusions can we draw from this research? There's really, I think, two major takeaways. Although this kind of research can't prove that water shutoffs cause an increase in COVID cases, it does show a really alarming pattern. It shows that water shutoffs are disproportionately impacting elderly people and families in Detroit. We can also see that the largest COVID outbreak in the city on the west side, in terms of numbers of cases, happened in the part of the city that's right at the center of the hardest hit place by water shutoffs. And so this practice of mass water shutoffs is incredibly dangerous and is putting our most vulnerable population in the city at risk in the middle of a pandemic. We can also, the other conclusion that we can draw is that pandemics don't stay contained within one zip code, right? And so even though there is a part of the city that's getting impacted the most by this, it's spreading everywhere. And so it's not just putting one part of the city at risk and not another, but this is spreading everywhere. And so it's putting everybody in the city at risk. It's putting the entire region at risk. And so we're hoping that this will help us build a case to extend the shutoff moratorium indefinitely, to stop water shutoffs altogether, because it's an incredibly risky practice and dangerous practice. So I'm going to turn it over to Nadia, who's really the public health expert here, and she'll talk about some of the other public health research that we've done.
Yeah, I just want to build on the note that you made about proof and like the high barrier of proof, because I think it's really the foundation of why community research has become so important in the absence of dedicated official city and state public health investigations into the consequences of water shutoffs. And I think that the patterns that we see in these visualizations of geographic patterns are incredibly powerful testaments to what we know is likely to be a confounding of geographic isolation, the lack of services, and the risks for both COVID but other infectious diseases. So another way that was available was to look at what infectious diseases were happening in the state of Michigan using hospital data, where these hospitals are required to report to the state. So George Gaines, who was a former deputy director of the Detroit Department of Health, did this white paper analysis in 2017 and looked at the rate of waterborne diseases that were centered in Detroit, whose timeline matched up with the initiation of these mass water shutoffs in Detroit, and found that in all of these three relatively rare water-related infectious diseases, rare in the United States, Campylobacter, Shigella, and Giardia, there was a threefold spike in the increases of cases. So you had 3 outbreaks at the same time, all correlating with the same time that the mass water shutoffs were instituted, and their epicenter was in the city of Detroit. So we wanted to look now like representatively at the city. So we looked to what tools were out in the public health literature to help us do assessments of what was actually happening, and took this toolkit from the CDC, which is often used in response to a disaster or an emergency, because we know that's what water shutoffs are, and organized more than 40 volunteers in an incredible effort to knock on more than 750 doors in Detroit. We randomly sampled blocks across the city, and we knew that this was going to be important so that people wouldn't accuse us of sort of cherry picking the data. We wanted to look representatively at the city. So as you can see, we looked at neighborhoods with high, medium, and low prevalence of shutoffs. This is kind of mapped over the shutoff data that we have from DWSD. And we did find that across high, medium, and low prevalence neighborhoods, where there were shutoffs, you had a high incidence of shutoff and notices. So 26% of the households in the city overall had a shutoff or a notice, and that included 5% of those households were without water at the time of contact. Unfortunately, We the People of Detroit also organizes an emergency water rights hotline, and so is able to connect people to emergency deliveries of water. We also found that there was a long length of shutoff. So the average in our study was 10.5 days. And at the time, the city was claiming that nobody was without water for more than 24 hours, that they were just using it as a tool to get people to come in and restart their accounts and fix the billing problems. But we know that people have been living in their homes without water for extended periods of time. And another finding was that 51% were using bottled water as their primary drinking water source, including 29% who only drink bottled water. And I want to come back to the question about what health effects do we know, but one of them is that bottled water has oral health effects from a lack of fluorination, and also the reuse of plastic water bottles is associated with very high risks of recontamination with all kinds of microflora and bacteria. So this is not an alternative to running drinking water, even for the purposes of drinking, let alone all of the other things that we use water for in our lives. So this is just a photo of some of our amazing community members who are part of the collective doing this mapping work, taking a toolkit, a federally resourced toolkit, and applying it to our data collection. Next slide, please. Can we go one forward? And I wanted to show at the time, Authority Health put out a recommendation that the shutoffs be prohibited for vulnerable groups based on health reasons. And so their exemption criteria included infants and children, seniors over 62 and above, people with mental illness and disabilities, expectant and breastfeeding mothers, persons dealing with chronic illnesses or otherwise in need of critical and medical care. And as you can see, when we did our survey, over 82% of the households in the city of Detroit would be ineligible for such shutoffs based on these health exemption criteria. Unfortunately, they were never adopted by the city of Detroit or executively required by the state of Michigan. So this is something that we're still contesting. And though there's a reconnection now, we want a permanent moratorium on shutoffs for everyone. If we could go back one slide, Alexis. Thanks. So we did a second study where we wanted to look more closely at a select group of people who were particularly vulnerable and establish whether all the emotional symptoms that people had reported to us during the first study, agitation, trouble sleeping, nightmares, depression, anxiety, could we prove and correlate those to water shutoffs? And so we designed this scale of water insecurity that's kind of grounded in what community members were telling us about the way that it impacted their lives, their domestic water use practices, and their mental health. And we used it against this, what's called the Kessler Psychological Distress Scale, which created out of Harvard and widely used in mental health research to kind of get a picture objectively of how it's impacting people. And we found in survey of over 100 people at the Brightmoor Food Pantry, sorry if you could go forward 2 slides. Thank you. That more than 1/3 of people were having trouble sleeping and nightmares, anxiety and stress, and agitated behavior, and about 1/4 had depressed mood. So these are all symptoms of the serious illnesses, depression, and PTSD. And we were able to statistically correlate that to correlate the water shutoffs to elevated rates of psychosocial distress, almost 2.5 times as high of levels of self-reported distress in these communities. And I want to say importantly, this is on the next slide, distress was correlated not only with not having access to water, but those who knew that their water bill was unaffordable, even that was enough to elevate people's agitation, anxiety, and distress. We also found in a smaller subsample that over 80% of people reported to us that they drank water they thought might be unsafe for their health. They worried about collecting water from an undesirable or dirty source. That was over 1/3 of people. And 80% of people worried they wouldn't have enough water to meet their basic needs. Sorry, this is actually more clear on the next slide. Emily did an amazing visual. This was causing people to reuse water to do their household tasks, so recycling from washing dishes to cleaning the floor to flushing a toilet. And another shocking finding, not to the community, but I think to the public health community writ large, is that people were worried that if they spoke of their water shutoffs, that CPS might be called and their home condemned and their children removed. So this is an extreme barrier to doing the kinds of public health research that we would need to quote unquote prove the correlations between shutoffs and infectious disease, because people are worried, echoing what Wani was saying about folks in Flint, that their immigration status or their housing status might be threatened, or even the safety of their children or elders in the home might be threatened if they report that they have water shut off. Next slide. So we continue to call for an immediate moratorium on all water shutoffs, and for the city of Detroit to implement a water affordability plan that's based on income so that everyone can pay what they're able. And we continue to ask that the city of Detroit must release water data so that we can complete these more thorough studies. As Emily mentioned, they have not yet released the 2019 or 2020 shutoff data. And they do this because the patterns become very clear once we do have those data and can look at reported cases of COVID, for example, and make those correlations. And then if I have a minute left, because there was a question in the chat about what we know about a lack of water access nationally. So I did a review recently, and I want to echo that there are limitations to these kinds of studies because water access affects all parts of our lives, not just our health, but socially, emotionally, as we've talked about. But even those that look at the kind of acute effects of water often undercount, and they don't look at chronic impacts. That said, there was a study of Native Alaskans in 2009 that showed that those who didn't have access to plumbed water had higher hospitalization rates for pneumonia and influenza, so 2.5 times as high. They had 2 times the rates of skin and soft tissue infections, which echoes what we saw in the Henry Ford study in Detroit. And they had 3.5 times infections of RSV, which is a respiratory virus that often impacts children under 5. So this has particular relevance for COVID-19 because it shows that these respiratory viruses, the #1 risk factor that was found for getting them was a lack of plumbing. And that finding was recently repeated among American Indian reservations in the SARS-CoV-2 or coronavirus epidemic in 2020. Sorry about the audio. Just a reminder if everyone could mute, thanks. So they looked at 287 American Indian reservations just earlier this year and found that language barriers, so access to translated material like Wani was talking about, and the lack of indoor plumbing were the 2 highest risk factors for getting coronavirus on these reservations. So I think this is really underreported and underlooked at. And thank you to all of you who are on for doing incredible work elevating this issue. And lastly, I'll mention the American Journal of Public Health did a spotlight on water access in the United States in 2017. And they published an analysis showing that 1/3 of US adults were inadequately hydrated. So there actually are, physiologic measures for this. So people are not drinking enough plain water. Plain water is only 1/3 of the fluid consumption that most US adults and children drink in a given day. And nearly 1 in 2 adults don't drink tap water on a given day. That rate is the highest in Black, Hispanic, and lower income communities. And we know from what we've heard and what we've studied that this has a lot to do with trust, has a lot to do with affordability, it has a lot to do with access, and it has a lot to do with contamination and fears about that. So I know dehydration may seem relatively minor, but it's actually a very serious medical factor, particularly for the elderly and those with underlying conditions, especially in cities that experience heat waves where it makes it very hard to regulate your body temperature. So I'm gonna leave it there so that we can go to Q&A. But I, thank you, want to let people know how you can get involved at wethepeopleofdetroit.com. You can find some of the maps that Emily has shared in the book, Mapping the Water Crisis, which is available online. There's links to donate if people are able to. It supports the work And there's also resource or links to our Facebook, Twitter, and other social media so that you can stay informed on what's happening in the community.
Fantastic. Thank you, Dr. Kudo and Dr. Gaber. And I would like to reiterate, it is wethepeopleofdetroit.com if you want to visit the websites. And yes, this was absolutely fantastic. There was a plethora of information, and this is a subject that needs to be elevated because there are people out there who have passions to put in that research, to be able to collect that data and be able to put together those documents and reports that are so needed as we present our case to government officials to advocate for change. And there are two main components. You know, we need the data and we need the stories. So thank you so much for accomplishing both sides of the coin to make it whole and make the case that much more powerful. And with that, I would like to conclude the speakers. I, again, would like to thank every single one of you for participating in this panel. And I would like to say that on the behalf of all participants. But now, let's move on to the Q&A. And our Executive Director of Freshwater Future, one of my favorite bosses I've had throughout my entire career. And she will be hosting the Q&A. And please ask any and all questions. Joe, please take the floor.
Thank you, Brandon. Wow, what amazing presentations. Thank you all for that great information. And that has definitely created some questions. So some of those are in the Q&A box. If you want to ask additional questions, you can continue to add your questions in the Q&A. I also have some that we've been calling out of the chat box, so I will ask those as well. But before I start asking, I wanted to see if the speakers had any particular questions you wanted to start with.
I can start with Gina's question just because I was trying to type an answer, who asked, didn't Detroit stop the water shutoffs in March? And yes, the governor's executive order did stop shutoffs during the coronavirus crisis, and the city of Detroit began this water restart program, which we certainly applaud. But we continue to have fears that many in the community have echoed, that there are barriers to getting access restored, whether financial or whether informational, whether not having the internet connection, calling a line that isn't answered. Basically, it was left up to the residents to call and make sure that a shutoff truck was able to come and shut them and cut them on. Because either the city doesn't have or didn't follow up with their own records of who and where the shutoffs had occurred. So in addition, they haven't guaranteed to extend that shutoff beyond this coronavirus crisis, even though a lot of the data that we showed and that we know about the relationship to infectious disease isn't only coronavirus, it's all viral and bacterial diseases that are waterborne and water related. Hand washing was mentioned, of course, as the #1 preventive measure for coronavirus, and this is absolutely limited. There's a study from a Nigerian hospital that was looking at different ways of trying to do hand washing in an area without running water. And there was only one method, which involved an elevated water tanker with a spigot that could be operated by the elbow and a soap dispenser that could be operated by the other elbow. And that was the only way to wash your hands safely if you don't have running water. So we know that there's no substitute for this, and a temporary moratorium, again, while we applaud it, just isn't enough to protect people's access to this vital resource.
Thank you.
I would just, do you mind if I add one thing to this?
Please.
So I'm gonna post a link in the chat. I get it. So another major issue with turning water back on when the state mandated that water be turned back on during COVID was that water shutoffs actually damage the pipes, the internal pipes in a home. And so it can cause all kinds of other problems with the plumbing. Many homes actually couldn't get their water turned back on at all because the pipes were so damaged from water shutoffs. And it could cause all kinds of contamination within the plumbing. So there's lead and other toxic chemicals that can be released when you've been shut off for a long time. So I'm going to post a link in the chat to a resource that we worked on that's on the People's Water Board website that I'll share. That's a set of instructions for how to flush a home's plumbing after it's been turned back on after shut off.
Excellent, thank you. Thank you both. I want to see if Wani wants to speak at all about the status of pipe replacements. I know that's not your particular area of expertise, Wani, but do you have any information you could share about that?
Yeah, I know some of it has been done throughout the city, but obviously because of COVID, it was stopped, and I believe they just started not long ago. I don't think that everything has been replaced, but I know some areas with higher lead have been replaced in throughout the city of Flint.
Thank you, Wani. And Reverend Pinkney, we know that some replacements have happened in Benton Harbor, although it's been much smaller number. Do you have any information about those numbers? I know that we've heard from the city that they have been able to do some prior to COVID.
They have been able to do some, but not as many as we would like. Matter of fact, especially since this pandemic, they have been, I don't think they have done any. And I think they have to have them all completed by the year 2021, if I'm correct. I don't know how it's going to get done, and they're very, very slow about actually doing things. Maybe the Freshwater Future and the Benton Harbor Community Water Council can come up with some ideas to help push them along to make sure they get it done. We was very successful at completing the water testing for the city of Benton Harbor. They have not had it completed in the last 2 years, and we went out and took care of it in less than 3 weeks, and we made that happen. But I'm very, very willing to put pressure on them, especially with the lead pipe, because at the rate they're going now, they will not complete the number of homes that need to be completed by, I think, 2021. Something like that. They're supposed to have them completed, and I don't believe it's going to happen. So maybe we can sit down and go over some things and come up with some ideas to present to them, because they're very, right now they're very receptive towards us. Normally they was fighting us about everything. They was trying to convince us that the water was good and we knew it was bad. And even the piping system, I believe is also need to be done. It's a lot more than the 30% that they claim, but we're gonna do what we can and make things happen. But we have to let's have a plan so we can execute the plan to make sure they complete what needs to be done.
Thank you, Reverend. I think, you know, in Michigan, for those of you who are outside of Michigan, in Michigan, we have a new lead and copper rule in the state that does a few things, including requiring over the next 20 years, or maybe it's now 19, we have to replace all lead pipes in the state. And so that the municipalities are trying to set up schedules for that. Obviously, when it comes to affordability, that's a huge question mark, because those pipe replacements they are very expensive, but they need to be done from a public health perspective, absolutely. And then in places like Benton Harbor, where the city is out of compliance with the lead and copper rule, there are even more constraints to make sure that those houses that have lead pipes and have high lead levels are moving forward first in the pipe replacements.
Absolutely.
Thank you for that question, Jumana. I'll go back to the speakers. Is there another question that you're seeing you would like to answer, anyone?
I can take Melanie Houston or Houston's question on why water shutoffs lead to more waterborne illnesses. So yes, there are multiple ways, and we kind of tried to compile across many. So one is that, yes, waterborne bacteria and parasites like Shigella, Campylobacter, and Giardia, that statewide study that was done, these are bacteria and parasites that collect in untreated water that is then consumed, and so you get these GI illnesses. Then you have the viral illnesses like the respiratory viruses, RSV, influenza, and now COVID-19. That spreads where people have poor access to water because they're not washing their hands as often. So a lot of it is just related to how often, now that we've learned, we touch our face, we use our hands to eat. And so that's really a hand washing problem. There are, as we mentioned, the psychological and emotional consequences of having your water shut off and of having your water not be affordable. And so that, ripples through all the social insecurities that come about when you don't have water access and you have to travel far from the home to get it. I think particularly during coronavirus, that's exacerbated. And then you had, what Emily and Honey and others have talked about, which is that water shutoffs lead to a lot of stasis in those piping systems. And these are old lead service lines for the most part. So there's lots of buildup of lead and other toxic contaminants. And then going back to what Dr. Berry was mentioning, in addition to those metals and heavy metals, there are industrial chemicals like PFAS and runoff from other contaminants that get through our water regardless of a shutoff, but again, have time to build up in these pipes when the water is not flowing. So for all of those reasons, there's multiple pathways that we could talk about that we know that shutting off water causes all of these direct and indirect harms that are both acute and chronic. And the last one, actually, I should repeat, is that just not having access to water or not believing that your water is affordable and limiting your access to water just decreases the volume of water, of plain water that you intake. So American Journal of Public Health was really concerned with people drinking more sodas and kids like drinking sugary beverages and actually a lack of drinking plain water being a big driver of the obesity epidemic. And as I mentioned, on the other side of the age spectrum, when the elderly are not well enough hydrated, which we know a third of Americans are not, particularly in communities of color, it really affects your ability to regulate your body temperature. It affects every organ system and can exacerbate any chronic underlying disease that people may have. So it is a serious medical thing. So again, many pathways.
Thank you, Dr. Gaber. That's really helpful. And thanks, Melanie, for that question. I want to move to Dr. Peggy Berry to talk about what is the main source of lead contamination, question from Larry.
Well, before 1976, it was paint. And in some instances, it is still paint. But also now they are talking about how lead poisoning is coming from the pipes going into the house now. I did a quick internet search, and mostly right now it is the pipes leading into your house.
And as well, I think, yes, sorry, Doctor.
No, that's fine. Go ahead.
I think people also don't realize that our fixtures, unfortunately, still have lead in them. And so as we buy a faucet or don't buy one, trying to be good environmental stewards, those older ones have a lot of lead. There are newer laws that require a smaller amount of lead, but there are still lead in our fixtures. And so in some cases we can swap out fixtures to help with that. So you can have lead pipes within older homes, you can have fixtures with lead in them, and then the pipes out under the streets actually have lead. And to kind of wrap up why that sometimes gets worse in some cities, it's all about the chemistry of the water coming out of the plant and how that interacts with the pipes. So sometimes we don't have enough anti-corrosives that prevents the coating on the pipes that can be calcium and other things from being eroded, and then you get direct contact of the water with the lead, and that's when we usually see the higher lead levels. So it's a pretty complicated problem. I know in Michigan right now, I believe we have 26 new water systems that are out of compliance with the lead and copper rule, and that's in part because we're testing better. Part of the change in the lead and copper rule was also that we have to be testing the first and fifth liters of water, trying to look at both what's at the faucet and what is coming in from under the street. So it's complicated, but it is a very real problem, and the only real solution is to get those pipes out. All right. Back to Professor Kudel, if you could talk a little bit about how the emergency management law has been used and misused in Michigan, and give us your thoughts about how that law exists now in at least 37 states.
So yeah, and thanks, Deborah, for underlining that again. I briefly touched on this when I was sort of talking about the context of the water system at the beginning of the presentation. And you can also see the emergency management map on We the People of Detroit's website. So if you go to our community research website, you can look at that map for longer, because I know I moved over it quickly. So emergency management in Michigan, which I know many of the people on this call are familiar with, is a law that allows the state government, the governor's office, to determine whether a community is in financial distress, which is determined by a state-appointed review board. If they decide that a community is under financial distress, they're allowed to appoint a governor-appointed official who can override all locally elected government. And so these people have the power to override city council, override the mayor, create contracts, break contracts, dismantle parts of the city government. And we saw all of that happen in Detroit and in Flint and many, many other cities across the state of Michigan. We analyzed the deployment of the emergency manager law and how that played out with racial dynamics in the state, and found that this law has almost exclusively been used, with a couple of very small exceptions, in majority Black communities. And very, very, very rarely, in maybe one case, a majority white community. It's almost exclusively majority Black communities in the city. And so this is an extremely anti-democratic law, which has enabled both the kind of mass ramping up of mass water shutoffs in Detroit, the bankruptcy of the city of Detroit, which was declared by an emergency manager, the Flint water crisis, and many, many other things in the state that have been hugely problematic for local communities, and are not based on democratic decisions or democratically elected officials at all.
Excellent, thank you very much. So I don't know if any of you have expertise in this area, but we have one question about whether irrigation with water containing high levels of lead has been shown, or even for cleaning the food, whether that's been shown to create health issues. Okay, I don't think we have that particular expert on the call. I know that the one thing I can say is I know that in areas with very high lead, such as Flint, we definitely want to be careful about places that have been irrigated with high lead water over time, and we'll test that soil for lead before suggesting people grow food in it. But I don't have any scientific data about the rate of uptake or how quickly that happens. We have a lot of thank yous for the wonderful panelists, which I totally agree with. I want to get to a few of the questions that didn't come in through the Q&A though. We did have a question about a map of PFAS contamination, which was answered, but the answer goes away quickly for everybody to see. So there is, the Environmental Working Group has an amazing map that they update on a regular basis. And that link, we'll put it again in the chat box so everybody can find that. There's a question about how did you get the zip code data for water shutoffs in Detroit? So I don't know if Emily, you might be able to answer that one.
Yeah, we issued FOIA requests to the Detroit Water and Sewage Department. So they usually send back a kind of spreadsheet. I can talk more about the FOIA process. It's been a struggle with the water department. They don't like sharing their shutoff data. So we're currently struggling to get data for shutoffs when COVID hit the city, and they're way overdue to send us the data.
Thank you. Yeah. We have a question also from Martha about water companies. She says they know how many connections they have, but why are they essentially asking people to self-identify? And I will just say that we've learned that this is pretty ubiquitous, that we hear that the water systems have, they say, purged the data about shutoffs. So after a relatively short time, a year or so, we're hearing them say that they purged that data. They still have the data. We know that because they are still making efforts to put liens on people's houses and go through those tax processes. So the data is most likely no longer in a water system database. It's probably in a financial database. But we hear this across cities. So you're right. I don't know if anyone wants to add anything on that question.
And I just want to say that the worst thing you can do for anyone is to take away their home for non-payment of a water bill they can't pay to begin with. And we should support them in a lawsuit. That's ridiculous. And what, if a city wants to do that, if they want to move people out like that, it's something that we need to get a little bit assertive about, or should I say aggressive, in letting the newspapers know that this is happening and how much this is happening.
Yeah, it's a great point, Dr. Berry.
It just makes me very angry that we do this to people. It really does.
Absolutely. We have to keep that in mind, that water is right. We can't shut it off and then even take away a home. Absolutely. We have a comment, and I want to bring this to the top, from Monica, saying Reverend Pinckney was a state and national leader on the issue of the anti-democratic and racist implementation of emergency management or mismanagement, and how it influenced the weaponizing of water. And I too want to raise the work that Reverend Pinckney has done for many years in Benton Harbor and elsewhere. We really applaud all that you do, Reverend, and we recognize that it's not always easy. We have another question from Larry asking Dr. Nadia, in connection with water shutoffs, how much of that could be contributed to not flushing the water enough when water is restored? Could the knowledge of how to do this help?
Absolutely. I mean, I think Emily spoke to this, and I hope that that link from the People's Water Board Coalition gets out, because there were concerns that after people experience water shutoffs, because those contaminants build up, if they're not properly flushing the water for a long enough period of time, then it will create like an increased exposure to these metals and contaminants.
Yes, great point. And Freshwater Future also has on our webpage resources like that from different states. I know some states want to do things a little differently. So if you're looking for something and you can't find it, you can let us know. We'll try to connect you with something for your state.
If I could add one more thing too, thank you. Emily did post that link again. But I just, in the Casper study that we did going door to door in the city of Detroit, one thing we also asked was whether people, who had received a shutoff notice had received any health related information about either what to do in the meantime, where they could go for resources, or how to get their water restored, and what to do in terms of flushing, for example, to protect their health when the water is back on. And overwhelmingly, people received no official communications about this. So in a way, it cycles back to the point about asking people to self-report. I mean, I think one of the big compounding factors about water insecurity is that all of the burden for navigating a complex bureaucracy, these complex and technical issues, is really placed on those who don't have the resources and the technical information, and really shouldn't be responsible for kind of advocating their way through a system that's supposed to serve them. So I think this is a way of displacing responsibility onto the poor, and even criminalizing poverty and pushing people, making them afraid of even accessing the services that they're entitled to. And I think that cycles back to compound the problems we were talking about in terms of what can we know and what can we quantify in data. It's really difficult when those who are in charge and have the records are not going out and making sure that comprehensive analysis is done, that studies are done, and that information is equitably and responsibly shared to everyone who is impacted.
Yeah, it's a great point. Thank you for raising that, because we see that across cities, and again, often people are, the first place they have to go is to the finance office. They've probably talked to the finance office many times before, and so that in itself can become a barrier because it's difficult. Usually it takes multiple days to get a call back. You have to sit by your phone, and then you have to be able to provide a lot of documentation many times. And so there are really high hurdles. Thank you. We have another question about water utilities saying that if they don't have the quote unquote tool of water shutoffs, they will not get the money to pay their own bills. Do the speakers have ideas on how to address the utilities revenue concerns? And I want you all to have the chance to answer this, but I'm also going to take a little opportunity. I think we have examples in the country already where shutoffs have been banned for a while, and we can look at those examples and see what the actual revenue changes are, because it costs a lot of money to turn the water off, and then turning it on and off all the time is a high cost. But also, if we look at plans that allow people to pay what can be affordable for them, whether that's a percentage of income, usually we look at, everybody can then pay into the system. Right now, if you're shutting off 10,000 people, none of those people are able to pay. And people want to participate in the payments. They just, most of the time, the payments are so large compared to their income, they're unable to do that. So if we can scale those bills by income, there are places like Philadelphia doing that, and we can look at those results and make suggestions. I think the other part of that is, as we have to update our more than century-old infrastructure, there are going to be new costs that are going to push at affordability even more. And we have to be much more innovative at looking about not only how do we fund those things, but also, do we have to just recreate a 100-year-old infrastructure, or are there new technologies and innovations that we can employ that may reduce those costs? So I'll open that up to any of you if you're interested in answering.
I can maybe just underline a couple of the points that Jill made. One thing that I want to lift up is that water affordability activists in Detroit were a part of the production through the People's Water Board in 2005 of a water affordability plan that was income-based, which was actually passed by City Council but never implemented in Detroit. And that model has now been picked up by Philadelphia and by Baltimore, and other cities are looking at it too. I know the state of Ohio is also looking at a water affordability plan. And so just to lift up, I think there's many people who've been working for decades in Detroit and around Michigan on this issue.
Great point. Thank you, Emily. And I will also just let people know, if this is an issue you're interested in, we have an expert, Roger Colton, who actually wrote the plan that Emily's talking about. He will be on with us tomorrow. So if you're interested in hearing from him and being able to ask him questions directly, that will be the topic, and he will be on to one of our speakers on tomorrow to talk with us. So. But great questions. These things are so hard to compartmentalize into separate days, but these are all the difficulties of solving these problems, is that they're very complex. So we so appreciate everybody coming on and making your expertise available so that we can make these connections and draw those lines. Dr. Gaber, did you have another comment?
Yeah, actually, if I could, I just absolutely, the water affordability plan is like a really vital tool for cities, and we know that it would work. But just to zoom back, I think alongside the question about emergency management and how all this quote unquote financial distress and crisis is created, the slide that Emily showed from Mapping the Water Crisis about how Detroit has really paid for the expansion of a water system that serves people well beyond the city of Detroit. It's 40% of the state of Michigan. And when the Great Lakes Water Authority was created, there wasn't a just redistribution of costs that other municipalities would pay into the city. So you have a cost shifting from the beginning, a wealth shifting really of the cost of providing water and sewer service onto those who live in the city that owns and operates the system. Well, unfortunately, we know that because of the long history of white flight and the suburbanization of the region, a lot of the wealth has been taken out of the city, and then the cost been just left to those who are in the city to kind of divvy up and be responsible for. So it is always important to look out and just underline what Emily was saying, what others have said. It's really, unfortunately, a problem that gets put on cities, especially majority Black cities now, given that history of racial segregation, that we could think of regional solutions to more equitable water payment systems in addition to water affordability programs in the city. And we could also make sure that we are advocating for a return of state and federal investment in water infrastructure, which has just slowly evaporated, again, leaving cities to kind of hold the bill for major infrastructure systems that really the federal government and the state governments need to be supporting with the tax revenues and the revenues that they collect from everyone who benefits from the system.
Thank you, Dr. Gaber. Those are such good points, and it's great that you can interweave some of the things we talk about on different days, so thank you. And I think I want to put a plug in for our 6th session, which will be next Thursday, because next Thursday we're going to be trying to pull all of this great thinking together in a strategy session. And so we hope as many of you as possible will be back for that more open and interactive conversation, where we really think about those kinds of answers, where we can raise the things that can help with affordability and help us move that forward and come to some collaborative understandings about how we can move those things forward. Not just in Detroit or Michigan or the Great Lakes region, but we know across the country these issues are playing out. And the same with some of the other things we've discussed. Deborah reminded me in a comment that, you know, many of these things happen outside of Michigan. So if you're outside of Michigan, emergency managers exist in 37 states. They're not exactly the same as Michigan, but they're out there. And so those are all things we want to be paying attention to no matter where we are. Let's see, I have one more question.
And I can't answer that question, Dale, I'm sorry. I don't know how to calculate the rates of what type of sulfite and lead would go into the Mini, I can't say it, river. I would suggest that you talk with the EPA up there or other organizations to help you calculate that core drilling and lead contamination and sulfide mining, okay?
Thank you, Dr. Berry. And for those of you who can't see the chat box, I'll just tell you, Dale Burry was asking, they're fighting a sulfide mine on the Menominee River in the Upper Peninsula of Michigan, which will also impact Wisconsin because that's the dividing line. The river is the dividing line between Wisconsin and Michigan there. And they're finding large amounts of lead in the core drilling as they prepare for this mine. And so, you know, they don't address that particularly because it goes into the river. And so even though there are 2 municipalities fed by that river in terms of drinking water. So he's asking, how can we calculate the potential contamination? And it's a great question. Dale is with Save the Menominee River, does great work. And we would be happy to reach out and put a question out to not only panelists who have been speaking throughout these seminars, Dale, but also to other connections with experts in and outside of universities to try and help you get to that answer. Thank you, Peggy, for trying to answer that one. It's a big question for sure, but I know we can help to solve that. Just trying to look through all our notes to make sure I'm getting people's questions.
Jill?
Yes, Reverend.
I have a question that maybe somebody can answer. In the city of Benton Harbor, they've been talking about privatizing the water there. And I'm thinking that, you know, not only will it's already doubled and tripled the cost already for the residents, and they're still talking about privatizing it. Can someone ask how do we go by to make sure that this does not happen?
Well, that's a huge point, Reverend. I appreciate you raising it, because we see things like that where on a short-term basis, maybe you'll get some private dollars investing in a water system, and they can actually do some repairs, and sometimes they'll even lower bills for a short time. But everything I have seen shows that over time that does not hold up. That for-profit companies have to make money for their shareholders. And so certainly here at Freshwater Future, we believe that that is a very dangerous path to take, because you lose the public control of that water being delivered, and you also then are susceptible to that company who is delivering the water, their need for profit and desire to lower costs. But I would be interested to hear from any of the panelists if you have other thoughts. All right.
One other thing on that issue, they were saying that the Benton Harbor water facility was too small even to handle the city of Benton Harbor, and unless they build a addition to the water plant. Before, we handled water that was in St. Joseph, Michigan, St. Joseph Township, and Benton Township, and it wasn't too small to handle those. But now they're just handling Benton Harbor, and they're claiming that the water facility is too small to handle just the city of Benton Harbor, which it's not even logical to me. I can't tell you exactly what's going on, but it's something going on, maybe with the privatization of the water. Maybe that's one of the reasons they're trying to sell it to the people. We don't have the facility to actually service the city of Benton Harbor. I don't know, but I'm the more I get into this water thing, the more I see things that's coming up and that keep popping up. And I see they want to privatize the water in Benton Harbor completely, take the resources completely out of the city of Benton Harbor.
It's a great point. Excuse me. It's a great point, Reverend Pinckney, and I think Freshwater Future too has been concerned about the way things are happening in Benton Harbor and the history of how things have been treated in Benton Harbor, with taking public land and selling it to private interests. There is a history of how that has happened with the state and having emergency managers. And I think right now with the lead being out of compliance, I think it's a particularly important time to monitor all of that. And so we can certainly have some more conversations offline about how we continue to do that, but would welcome any other thoughts if anyone has them.
I have a small thought to share, just based on our experience in FOIA-ing the Detroit Water and Sewage Department to get shutoff data, FOIA has been really one of our only recourses to hold the water department accountable for tracking water shutoffs. And we have seen over and over again throughout the past 6 years that I've been involved in this, that the water department puts out misinformation about shutoffs all the time. So Nadia brought up earlier, they say that people get their water shut off within 24 to 48 hours, or water turned back on within 24 to 48 hours. But when you actually look at the data, that's not true at all. In 2014, we found the average was 45 days. And Bridge Magazine, looking at 2019 data, found that it was an average of a month, I believe. And so only, I think, 50 people in from the whole year had their water turned back on within a week. And so, you know, it's private companies are not subject to FOIA laws. And so, you know, we're having a major transparency problem even with a publicly owned water system. So just imagine how difficult it's going to be to hold our water systems accountable when we can't FOIA them.
Excellent point. So important. Thank you. Excellent. Well, I think I'm going to look one more time, Brandon, through and see if there's any other question. But I also, I want to take an opportunity, we have a few minutes left, to again thank our speakers that have been just amazing with both taking questions and all the information you shared. I want to especially thank our All About Water Planning Committee that has done an amazing job. They meet right now, they meet weekly because of all that's happening with water during COVID. And they're from across the region, community leaders, and they are really the ones responsible for putting this agenda together and helping us find speakers. So we so appreciate all that they're doing. Great job to Freshwater Future staff, Brandon and Alexis in particular today. Thank you for your great job. And we want to thank the Elevate Energy and the CS Mott Foundation for the funding to make this happen. Absolutely. And then finally, I know that for some, this process of having to be apart from each other is very frustrating. The only way we could be able to make this possible was doing this webinar format where we can't see the other 50 people who are on the call, except other than the folks speaking. And so one thing we want to try tomorrow at 4 o'clock, which is at the end of tomorrow's session, is holding a happy hour. So we'll use a different system for that where we can see everyone, and we will also be able to have breakouts. So we're hoping many of our speakers can come to that. There might be questions that could be discussed in breakout rooms. It would be a chance for us to see everyone's face, which is really important to us. And we want to invite you to, bring a beverage with you, bring a snack, and we'll try to make it truly a fun time where we can reconnect in a different way, even though it's still not in person at this point. So with that, I want to see if there are any last comments from our speakers, and then I'm going to turn it back over to Brandon.
Just a big thank you to everyone else who's presented. I learned a lot from people I had met before, and thank you to Freshwater Future and to Alexis for organizing everything so seamlessly. I like that these webinars kind of bring disparate perspectives together in series over a couple of days, and I appreciate the work that you all do.
Thank you very much. All right.
And to everyone participating very actively in the chat, again, who we can't see, thank you.
Yeah, it's amazing. I love the chat. I can't quite keep up with it in real time for questions, but it is great. All right, it looks like that's it for our comments. So Brandon, I'm going to turn it back to you.
Wonderful. Thank you, Jill, for doing a wonderful job, as always, hosting the Q&A. I would like to thank all of the participants for being so engaged, so enthusiastic, so curious about the topic, and being able to share your own insights. It has been incredibly useful and uplifting and energizing for that matter. So again, thank you. I would like to give a thanks to all of the panelists for giving such wonderful presentations. We all appreciate your powerful movements and leadership within your communities throughout the nation, throughout the world, and continuing to be an inspiration and taking hold of the matters that need to be dealt with promptly. So with that being said, we are 8 minutes at the bottom of the hour. This is a great time. If you're going to have lunch, you have 8 extra minutes to have that lunch. So we want to wish you all a wonderful day. We want you to enjoy this weather, and a reminder that tomorrow's webinar will be at 2 p.m. So everybody enjoy your day. Panelists, thank you again and enjoy your day. And we will see you all hopefully tomorrow.
All right.